Good evening. Glad to have you joined us on Soundhealth on Lagos Television. I am Olasunbo Mudukwe. This week we are looking at viral hepatitis, how to curb the further spread or reduce the statistics in Nigeria. The World Health Organization says over 12 million Nigerians are carriers of chronic viral hepatitis B. Out of these statistics, about 900,000 children under 5 years of age are also carriers of the antigen. Today on the program, Dr. Victor Adepoju will tell us more on how to prevent viral hepatitis in the society. Please stay tuned. The conversation begins in a moment. It is still Soundhealth on Lagos Television. Joining us via Zoom this evening is Dr. Victor Adepoju, Director HIV and Viral Hepatitis Self-Testing in Africa Project Jpheigo, Nigeria. Good evening, Dr. Adepoju, and thanks for always obliging us.
Good evening, and thank you for having me.
All right, Dr. Adepoju, this week we are looking at hepatitis. Tell us, what exactly is hepatitis? We all know that it is an inflammation of the liver. Tell us what exactly is hepatitis and what causes this condition in people.
Okay, so thank you very much. Hepatitis, just like in medicine, anything that ends with CIS most times has to do with inflammation or something. So hepatitis, like you said, is just the inflammation of the liver. The word hepa is referring to liver, and ISIS is talking about inflammation of the liver. And a couple of things can cause inflammation of the liver. The viruses are just one of those things. That's why we have viral hepatitis, which is inflammation of the liver caused by virus. It can also be caused by a couple of other things like alcohol. We can have alcoholic hepatitis, and all the rest of them. But I'm sure that what we are talking about and discussing today is viral hepatitis, which is the inflammation of the liver caused by virus. And it's really a major cause of morbidity and mortality globally, and as well as in Nigeria. And less attention has been paid to this deadly disease by governments, by international donors, for obvious reason, because the symptoms doesn't show until when the person has few months to die. So I guess that this year's World Hepatitis Day, the government of international donors, governments of different countries will be able to use it as a clarion call to invest more and to prioritize viral hepatitis.
All right, Dr. Adepoju, from your explanation, you said it is deadly, and most people know about this condition maybe towards the end of the phase. Now, let us know, are there types? Because oftentimes we hear hepatitis A, B, C. What are the types, if there are truly types? And let us know the differences.
Okay, so we have almost about 5 types or even more, but the common ones are hepatitis A, B, C, D, and E. The one that is common with us here in Africa is usually the hepatitis B. While C is more of the Western world, North America, Europe, and the rest. But of course, recently we've also begun to see rising numbers of hepatitis C also in this part of the world in Africa. Hepatitis A is also common. Hepatitis A requires to thrive, to replicate, and also is not too much of a problem with us, but you can also get it from things like Fecora root and the rest of them. But the common ones that I think is deadly, that kills more people, especially in Africa, is hepatitis B and hepatitis C. And both of them also have similar route of transmission. They can be transmitted through the blood or through some injection with unsterilized materials, blood transfusion, sexual intercourse, unprotected sexual intercourse, exchange of needles, especially among injection drug users, what we normally refer to as people who inject drugs in this part of the world. So these are some of the route of transmission. It's also common even among healthcare workers providing services as well as in the population. And it's been said that 90% of hepatitis B is transmitted at birth. So this virus can stay in human body without any symptoms, even up to 30, 40 years. So you see most people coming down with symptoms in their middle ages, around 50 something, for late 40s, when the virus has been acquired right from birth. So that's why we say that the single most important intervention that the government can adopt to really end viral hepatitis in Africa as well as in Nigeria is to make sure that people are vaccinated at birth and also have supplementary doses as recommended by World Health Organization. If we can do this, we can arrest the virus right from birth, since 90% of the virus is acquired at birth. So it offers us a very big opportunity to strengthen our routine vaccination for viral hepatitis at birth, and people can also be boosted, and then we can put an end to viral hepatitis. Those who are already infected can also be treated. It's treatable. Viral hepatitis is treatable, but it's not curable. However, viral hepatitis C is curable, especially after 3 to 6 months of treatment. So these are the most important singular thing that government can do to arrest and have a hepatitis B population is to strengthen our immunization at birth, making sure every child that is delivered, whether in the hospital, at home, or anywhere, is given the dose of hepatitis at birth, hepatitis B at birth. Hepatitis C is not preventable by vaccination, but we can stop and arrest hepatitis B through vaccination at birth and even booster doses to make up the 3 doses that WHO recommended. And that has capability of 95% prevention of infection. We can have hepatitis B-free generation.
All right, Dr. Adepoju. The World Health Organization says another angle to this whole infection path is drug-induced hepatitis. It is a major concern. How do we go about this? What exactly is drug-induced hepatitis?
So there are a couple of drugs that also affect the liver. Some of these drugs are metabolized in the liver, the likes of NSAID, the non-steroidal, the likes of, and it's common in this part of the world when people go to the market or artisans, they come back from their daily work, they like to just, take all sorts of NSAID, paracetamol, ibuprofen, and the rest of them. These things have effect on the liver, and they can reduce. So I would say that our drug use has to be improved. Most of the time, we need to make sure that some of these medications are prescribed by qualified physician. Self-medication, we need to educate the population against self-medication, because some of these drugs have drug-drug interaction, especially in the liver, or maybe you are taking a particular drug, and some of these things are metabolized in the liver, and there's a need for us to overdose of drugs, abuse of drugs. Some of those tissues are very critical, and the way to go about it is to make sure that most of these medications are prescribed by qualified physician who is able to evaluate the effect of this drug on the liver. So I think that's just it for drug-induced hepatitis.
Apart from these routes that you just portrayed, are we prone to hepatitis? Because according to the World Health Organization, about 12 million Nigerians are chronic carriers of viral hepatitis B. Is there a way we can, ward off hepatitis without getting vaccinated, or are there lifestyles to embrace apart from self-medication?
Yeah, so it's a complex situation that we find ourselves. That according to what we call the NAI survey, the National AIDS survey that was run in 2018, they also did collected some samples on hepatitis during that national prevalence survey for HIV. They did also collect some data on viral hepatitis. In Nigeria, the prevalence of hepatitis B in Nigeria is about 7.2, 7.1%, while while that of hepatitis C is 1.1%. However, even though we have 7.1, 1.1% for hepatitis B and C respectively, there are some states where the burden of the disease is higher than the others. For instance, places like Nasarawa State, Taraba State, who happen to have very high burden compared to the average prevalence in the country. So this call for attention of government in those states. And there are a lot of precautions that we can take to avoid this. Like I said, the route of transmission includes sexual intercourse, making sure that protected sex is very critical. Most people think about HIV when they're having it unprotected, but viral hepatitis is also another infection that can be transmitted sexually. So we have to make sure that we protect ourselves, we stay with our sexual partners, multiple sexual partners, unprotected sex are some of the risk factors to acquiring this infection. The other thing that is common in this part of the world is the safety of our blood, the blood that is given. We have a couple of places, especially the rural part of the country, or even some urban hospitals, whereby blood are not properly screened before they are being transfused. So this is very important. And then it's not also about screening the blood for hepatitis. The type of equipment, the type of facility that is being used, they are more sensitive than each other. We have some places, I've seen some places in this country whereby people are using the rapid kits to screen for viral hepatitis. And this rapid kit, they have variation in terms of their sensitivity and specificity, and they are prone to false negative results. And when you use this, you rely on this to screen blood, and it gives you negative results, and you go ahead and transfuse. You didn't subject that blood to proper PCR to be able to find out if that person actually have antigen or antibody to any of these viruses. You have subject that patient or that individual to risk of acquiring hepatitis, even from the hospital, from blood transfusion. So our blood safety program needs to be strengthened across board, making sure that we have a proper screening method to be able to screen out blood that has been given to people. So that's also very, very important. For the PWID, who also drive most of this infection, there are key populations that drive a lot of, especially viral hepatitis C, from exchange of needles. A very strong injection needle exchange program is also very important, and UNGOC is also doing a lot of work in the country, but we need to scale up that among those people who inject drugs to be able to make sure that safety is prioritized. Needle exchange program in our needle exchange program in the country. So these are some of the things that we need to do to be able to. Also, we need to make sure that our hygiene is very proper because hepatitis is highly infectious, especially when you have the E antigen. It's highly infectious. Things like sweat alone, So we need to make sure that all these things are avoided. Regular hygiene of our body. Making sure that. Wash our clothes regularly, contacts, it's very important that we take all these small issues very, very seriously. And regular screening for viral hepatitis will also help us. Pre-employment screening, admission screening. These are some of the places. I remember when I was in university, there's one of our professors I'll always be grateful to. He makes sure that when you want to rotate through our units, all the medical students, you have to go and screen yourself for viral hepatitis. It will tell you to go and donate blood, and then before you donate blood, they have to screen you for viral hepatitis and HIV. So it's amazing that most students find out for the first time in their life that they are infected with viral hepatitis at that point. So these are some of the things that we can do to make sure that those that are free of the infection are able to protect themselves right now. But again, I will still tell us that the most important intervention that we can do to put an end to viral hepatitis is to strengthen our vaccination program at heart.
Dr. Victor Adepoju, Director, HIV and Viral Hepatitis Self-Testing in Africa Project Jpheigo, Nigeria. Thank you so much for your expertise on Sound Health today. We really appreciate you.
Thank you, and thank you for having me.
All right, I have been speaking with Dr. Victor Adepoju, Director, HIV and Viral Hepatitis Self-Testing in Africa Project Jpheigo, Nigeria, on how to prevent viral hepatitis in the society. Sound Health continues with Trending Health Report. Please stay tuned. It is still Sound Health on Lagos Television. More to come in a moment. All right, this is where we say thank you on today's episode of Sound Health. Remember, viral hepatitis or other health-related conditions are preventable. Get tested, get screened, and get vaccinated. Vaccines are safe, free, and harmless. Protect yourself and your loved ones. Join me again next week for another edition. But before then, for comments and inquiries, please send SMS to 0035 826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.